Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast. Dan Carter here in the studio this morning. I got Dr. Brown and Dr. Hoffman. Look at me getting that right this morning. Oh, except your brown feel. Go with Brown.
We're going with Brown.
We're going with Brown. Sorry, Thor. So, all right, we're here this morning. It's been a pretty good week, I think. We had some interesting things coming down the pipe. This podcast, we're going to talk a little bit about... this is becoming more and more common. More and more states are adapting the Practice Act. So for our listeners out there, what a lot of people don't realize is the state each state sets up a state board. And the state board advises and helps sets the rules and regulations on how we can practice, what is legal, what is not legal, what we can do, what we can't do. Every state is different. So every state sets their own rules. And these are the rules at which we must abide and practice in. So, one of the things I think about is a lot of people call in and says, what do you mean you can't do that? And we're like, we're governed by these rules.
Right.
If we violate these rules, we can lose our license. If we lose our license, then
we can't help anybody.
Yeah. We can't help anyone. So we're given these guidelines. They're not guidelines. They're just hard and fast rules by the state, and we must stay within those.
Right.
So what we're talking about today is a new edition, and this is just the Georgia rules. This is just for Georgia. If you live elsewhere, your state laws may be different. But what we're talking about is telemedicine, tele-triage, telehealth,
Yes.
and the new rules that have come through from Georgia. On what we can and can't do, how this works. So let's start off. Let's talk about a little bit about what. So there's a couple different things here. You got telemedicine and tele-triage.
Yes.
So let's kind of go through the differences between telemedicine and tele-triage.
Right. So there's this is Georgia Senate Bill 105, which is kind of all of the amendments to this. And this is all their specific definitions of what this is. So there's kind of three sectors of it. So there's tele-advice, which is you're just giving advice. It's not necessarily specific to this animal or a certain diagnosis or a treatment. It's just we're having a conversation about this. Then there's tele-triage, which is an emergency assessment. So that's where we're saying, hey, this is the situation. And then we as the licensed veterinarian have to say, okay, what are our next steps with this? Right.
And then need to be seen or
doesn't? Yeah. Can we manage this at home? Do we need to, go and see this in person?
And one thing that's kind of interesting on that is if you actually read these rules, every person that we've ever talked to that has called in for an emergency and we decided, should they be seen? Do they not need to be seen?
Right.
I didn't realize this till reading this. Technically, we were breaking the law.
Apparently, per how this is worded, we weren't supposed to be doing that.
I'm like, how do you function otherwise?
And again, I'm like, think of how many, that's how we practice. That's how we've done everything.
Yeah.
I mean, yeah, it's like every time somebody's called me and they're like, hey, we're on the road and they're a little bit colicky. I was like, do you have some Banamine? I'm like, okay, give them some Banamine. Let's get them over here and look.
Even the fact that we decided whether they should be seen or not seen.
Yeah, right. That's not.
Whether we said, yes, we need to see you, no, we don't need to see you, doesn't matter. The fact that we made a triage
had that
decision,
conversation.
Yeah.
Is, interesting. But when you phrase it like that, it's like, whoops.
Yeah, that was the first thing that jumped out at me when I read the tele-triage, which triage is just determining, how fast do we need to be there. Because sometimes we get 3 or 4 emergencies and we have to go and do what we call triage. We have to say, okay, this is the most severe. We need to get there first.
Right.
But technically, every time we did that.
Until now.
Until now.
We weren't supposed to be doing that over the phone.
I had no idea.
Yep.
And a little disclaimer in here, none of us are attorneys. We're just trying to read this the best we can.
Right.
To understand.
And I think a common theme here is that some of the language in this bill is very vague. And it's very interestingly worded that there's a lot of room for interpretation.
And didn't we say when we were doing the research for this, didn't we come across the stat that was like it hadn't been updated for like 20 years or something?
Yeah, it hadn't been updated since the 90s.
Yes. And so like obviously with the advent of cell phones and everybody has a dang computer in their pocket now, like obviously how we practice medicine has changed within that time. So it's not like we were out here just willy-nilly.
And I would love if there's any attorneys out there that really understand the Georgia Practice Act and you want to come on the podcast, I would love to have you on here.
Yeah.
Help us truly understand. But
help us find all the loopholes.
Yeah, but that was the first thing I found very interesting is I didn't realize that every time we decided if an animal needed to be seen, in what order it needed to be seen in.
Over the phone.
Over the phone.
Not like in person.
Right.
We broke the rules.
Oops.
Whoopsies.
Sorry.
Don't come for us.
No,
Please.
sorry, guys.
Don't dox us.
That's every veterinarian out there.
Truly.
Yes.
So, all right, moving on.
Moving on.
Sorry about that. Just something I realized.
Something. Well, and the last definition with that is actual telemedicine is when we are making a diagnosis and treating this animal over the phone, over a video chat, through pictures, what have you, basically not in person.
Yeah.
So that's the other kind of big thing. And so this Practice Act is basically trying to redefine the standards, like what are the minimum standards of care, by adding this component into that. Since it's never been a thing, like we said, we all have tiny computers in our pockets these days. And I can scroll through my phone and it's just pictures.
Oh, yeah.
Or videos.
Pictures.
Or people
text
asking me
messages,
questions about cases we're working on.
voicemails, the whole thing is in there.
Yes.
So I think the things that are interesting to me about this is I do think there are some good things in the bill, that it's good things in terms of like we said, this is how we've always been doing things, but now it's putting it in writing and it's legalizing it essentially, and it's giving us clear, like hard and fast rules for how we can do these things. I shouldn't say clear. That's not clear, but it's giving us a sort of structure and updating to it's kind of getting up to speed on how we've been doing things.
Right.
In the past.
One of the things that I really like about this is, so one of the things we're going to talk about a lot is the Veterinary Client Patient Relationship, or the VCPR. That's kind of the, keystone to everything that this bill is. And, what is a VCPR and how do you get one? And this whole bill is kind of redefining how you get there.
Yeah.
But basically what that means is that I am a veterinarian and I have assumed responsibility for your animal. And I know I'm familiar enough with your animal to make a reasonable decision on this, like how we're going to, treat this animal. Like, what are we going to do? And the client acknowledges that we have that, and the client consents to whatever treatment that we decide to do. But it actually extends that VCPR to any veterinarians that are within your practice. Which again, we've always practiced. We've always been doing that too.
Because every time, I see something on a Thursday and I see it, I make a treatment plan, I have a diagnosis, I have, this care plan, I write my medical record, which includes my physical exam findings, my plan, my next steps, and then Dr. Brown is on for the weekend, and the owner calls back on Saturday morning, and she reads my medical record and takes over care of that animal for the weekend. We've always practiced that way.
But now legally we're allowed to do that.
Which is wild to me, because I'm like, how would we have functioned any other way?
Well,
we would all have to be here 24/7, 365 days a year, and not share cases and not collaborate on cases. And how are we supposed to do that?
Right. Especially again, if it is something where you're unavailable. Right. And one of the case that you've been working on is crashing. And then we're just supposed to be like, oh, sorry, she's not here.
Right. That's
Like-
terrible. Like, how is that good care?
And I'm like, I'm just sitting over here. I'm like doing nothing. Like, oh, sorry, can't help you.
Yeah.
Like,
Well, and the other thing, when we're getting into this veterinary client patient relationship, is there's two components to this, right? There's the legal definition, which is very vague.
yes.
And then there's what we have decided is standard of care. And then what a lot of people don't realize is there's laws. And there's also what's deemed to be standard of care. And this is what any reasonable veterinarian would consider to be appropriate. So that's where the standard of care comes in. Like, it's basically standard of care that if you've seen the pet within 1 year, you have a VPCR. But that's not codified really
Right.
anywhere. But that is considered the standard of care. And
Yes.
so these are the rules we must play by. These are this is that gray area. And we've always held hard and fast here because, again, if we lose a license, we can't
We're done.
can't help anyone.
Yeah.
And so when you get into that VPCR, it's something that's also it's not there just to make things difficult, but it's there for the protection of the animal.
Right.
Right.
Because you need that relationship, you need that familiarity and recent familiarity so that you're aware on, animals change from year to year. Diagnoses come up, like medical problems arise, management changes, like they may change location, they may change diet, they may change all of these things that become a huge factor in caring for that animal holistically. And we need to know about that.
Yes.
And so that's where we get into having that relationship. We've always extended certain things. If we're getting updates on cases, I guess we're going to admit to breaking the law here, but we've done a lot of stuff on pictures and videos. Like, if we're dealing, wound care is the one I think of a lot.
Yes.
Oh, yeah.
Instead of us driving out there every week to
Because
see how wounds manage them, because it's not feasible,
It becomes cost prohibitive.
we do a lot of pictures.
Yeah.
Y'all probably do more than I do, but I'm not good with pictures. But I still do. We look at a lot of things, a lot of videos. If we're monitoring something, there's a lot of ways we've done that, and that is technically telehealth.
Yes.
Is what that is. But this makes it
Legal.
Legal, right. But again, we're able to do that because we've been actively managing that case. We know what we've done treatment wise. We know that animal, we know that client, we know what we're doing. If somebody that I've never met before or seen their animal sends me a picture of a wound and said, what do I do with this? I'm like, whoa, like that's, I personally don't feel comfortable doing that.
No.
Because I'm like, I don't know you. I don't know, what your animal's been through. I don't even know what this wound is. It could be a scratch. There could be a bone chip in there.
Well, I think that's where you get into when you're looking at a lot of these things. Like, we'll get pictures in, or people will call and we're like, we need to see it. Well, can't you just prescribe something? And I was like, there's so many nuances to things.
Yes.
Like,
Tele-triage, yes. Telemedicine, not always.
yeah, because there's little details. I mean, I think about some of the cases I've gone out to over my career where they call for a colic, and it's not a colic, it's a choke.
Yeah.
I've also gotten the call, it's a colic, and you get there, it's not a colic. It could be a raging fever, and we're dealing with a pretty serious infectious disease. We got a barn full of horses. Like, well, somebody could take a temp.
I had a broken bone once. It was a colic.
Yeah.
And the horse broke its leg.
Yeah, I've had a colic that was in severe heart failure.
I've had wounds that look pretty superficial, and you get there and you stick a probe in them and it sinks down to a bone, to a joint, to a soft tissue structure. Like, you don't know. And if it's our first time looking at a new problem, I'm going to want to see it. Even if I do have a valid VCPR with that person, I'm still going to want to assess it in person first. And definitely, if I don't have a valid VCPR with someone, I'm absolutely going to want to see it. I have to.
Yeah, because there's so many little details that you can't get from picture and video. There's so many, and you can't get from history. I'll never forget. I remember hearing in vet school, the most important thing you ever do is a physical exam.
It is.
Yes.
And we talk about that on this podcast time and time and time again.
When I can tell you, I always remember this from being an intern. We had a case coming in. I had the pleasure of working with like one of the best neurologists in the world, Stephen Reed. And I love Stephen Reed. And he was no doubt he wrote the book Equine Neurology.
Yeah.
And I'll never forget when he came in and gave us this history. There's a few interns sitting around. He gives us this history. He's like, what do y'all want to do? And we had literally sat there. We had CT'd this horse. We'd MR'd it. We had run EMGs. We'd done myelograms, all kind of tests. And he just sat there and he's like, guys, why don't we start with a physical exam? Mm-hmm. And this is the best neurologist in the world that had a competent history. But to him, the most important thing we're going to do is a physical exam.
Yep.
Because I can't tell you the amount of times that I've done a physical exam on a horse for something and I've noticed something else, which makes me ask a different question that I never would have probably over the phone. And it takes me down a completely different rabbit hole that gets me where I needed to be. And I probably would have never gotten there.
Mm-hmm.
Right.
Had I just looked at the one picture of the one wound or the one issue. Like, you've got to look at the whole thing.
Mm-hmm.
I've had one recently that like a horse had random bouts of colic episode and we had been doing different things. Nothing was really working. I'm out at the property. I start looking around and like, there's spotlights everywhere. And I'm like, are these spotlights on all the time? Mm-hmm. This horse hadn't laid down to sleep in like days.
Oh,
This horse was exhausted because the lights were on.
yeah.
Turn the lights off. Guess what? Everything stopped.
Yeah.
A couple days later.
Yeah.
Same thing. How many mares have you seen? Because these heat cycles controlled off of light. Mm-hmm. And I mean, I just had this other day with a friend of mine. Like he was having issues with his mare. He'd bought this mare. She was just terrible to deal with. He's like, I don't know what happened. I think they had this thing drugged. I drove by his house one night and I see the mare standing out in the corner of the pasture. And because they built this new intersection by him and this new roundabout, this roundabout had these massive lights on there. And I looked down and I was like, hey, I think I know the problem. Sure enough, we moved the mare and she was better.
But again, you have to be physically there because it's not something that I wouldn't think to ask that.
Yeah.
Unless I'm like way down the rabbit hole and I've tried everything else. But even then, it's like, it took me physically being there and looking at my surroundings, being like, we got something here.
Yes.
Well, even if you look at something as simple as a colic, a colic just means my belly hurts.
Yeah.
There's a whole lot of reasons that belly hurts.
Yeah.
I mean, this could be a surgical candidate. This could be, I need IV fluids. This may be we had one the other day that was a colic that ended up being a nasty peritonitis. This thing had a leaky bowel and it had a peritonitis.
I had one the other day that was a nasty bladder.
Right.
I had one that was a foot abscess. It hurt so bad that the horse was like hurling itself on the ground, dying.
Yeah.
Yep.
Well, it started colicking secondary to the foot abscess. But if we don't fix that, the colic's not getting
Colic
better.
doesn't get better.
Well, and I just think of every time I go somewhere and the practice of veterinary medicine is truly using all of your senses. Your touch, your hearing, your sight, your smell, like you're using all of it. And you have to, because that's how we glean all of our information, because they can't talk to us.
Yeah, and that's what when you're looking at telehealth, you're basically trading 5 senses for one. You're looking. You might can hear some stuff. And I can tell you the hardest thing in the world for me is I get these videos for lameness stuff. Like,
Oh, Lord.
What do you think's wrong with him? I was like, I don't know. He's lame on the left front. What do you think it could be?
Could be a lot of things.
I don't know.
Shaky hands with your camera and you're filming in the dark and there's like 3 horses walking behind them and they're doing this and you're trying to film and the horse is like kind of limping and you're like,
And a dog comes into frame right when the horse is like finally straight away from you and you can't even see it anymore. Yeah.
I'm like, what do you think's wrong? I'm like,
They're lame.
get a tripod. Let's start with that.
But and the hardest thing is like all we can get from that's their lame.
Yeah.
Yeah.
What should I do?
What do you
Bring
think
it
is
in for a
wrong?
lameness exam.
Yeah.
That's
Which
again,
until recently we were
supposed
breaking
to
the
illegal.
rules.
well, and even I think about it, because
So we were just supposed to ignore people.
yeah.
Then
You have to physically bring it here, make an appointment, and we'll talk about it. But I mean, think of all the times again that people send us the pictures and videos and stuff. I feel like at least 75% of the time it ends with, yeah, we probably need to look at that.
Yeah. Oh, yeah.
Like, majority of the time, that's what it is.
I feel like the only time I don't say, yeah, I need to look at that is when I've already seen it.
And we've been managing it.
Yeah.
So yeah, that VPCR, it doesn't exist. It exists to protect the animal.
Yes.
And I think that's what people need to realize is when you get frustrated because your veterinarian's not making a call, it's not that we're out here trying to make money. And these rules were not set up to protect. These rules were set up to protect the animal.
Yes.
The state veterinary board they do not exist to protect us.
No.
They exist to protect the animals and the people that we care for. That's their job. They're not there on our behalf.
No, they're very clear about that.
Yes.
Yeah.
They're very clear that they could really care less about us.
So the state veterinary board, who exists to protect patients and clients, has established these rules and established the VCPR rule to protect you guys, not to protect us, to protect you.
And we all agreed when we got a license that we would follow these rules.
Yes.
Under oath.
Right. And like I said, I'm licensed in a lot of places.
Yeah.
I mean, we got a list somewhere because I forget where all I'm licensed at. But I'm licensed in a lot of states and other countries. And I have to follow the rules in each and every one of those. So depending on what state it is what rules I have to follow.
Right.
And I will say too, like coming out and pulling a Coggins on your horse once a year is not a VCPR.
No. You've got to have a physical exam, minimum.
Yeah.
Minimum. Yes.
Minimum. And there's times at which you may have a VPCR, but it does not mean that we can prescribe. It doesn't mean we can treat over the phone. That is our call to whether we feel that is right, because that becomes not from a legal standpoint, but it becomes a standard of care.
Yeah, like an ethical.
Right, and the standard of care is also how we'll be judged by the board.
Correct.
So, and again, it's what a reasonable veterinarian would consider. And I always hate that term, what a reasonable veterinarian, what reasonable.
Yeah.
Yeah, what does that mean?
Because especially in our world, one of the things I look at is sometimes the quote unquote jury of our peers, i.e. the people that are deciding our fate, they're not equine veterinarians. They're small animal veterinarians. And I'm not saying that anything bad about them.
But it's very different.
But it's two different worlds we live in. Two completely different worlds that we live in. So, but yeah, so let's kind of dig in a little bit. We talked about VPCRs. We've talked about telehealth. We've talked about tele-triage. But let's talk a little bit about what this means that we can do, and let's talk about what it means that we can't do, and some of the pitfalls that people can wind up in. Because again, these rules exist to protect your horse.
Yes.
And we're going to talk about horses here because this is an equine podcast. So we're gonna phrase this in the way of how we see the world as equine veterinarians and how we understand what we can and can't do. And like I said, if you're listening in other states, you're gonna have different rules.
Right.
So it's gonna vary state to state, but this is the rules we deal with here in Georgia.
So this is all defined in these amendments. So everything is laid out here. We're just kind of giving you all the summary. If you want to read it, it's public record. It is interesting. I had a lot of questions as I was reading it, basically. But basically, if I as a veterinarian say I would like to perform telehealth, I have to, first of all, inform the state that I said, I'm going to do this. I'm going to operate on a telehealth platform. Doesn't tell you how to do that, but
I was going to say,
you have to send a letter to the state informing them that you will be doing this.
I just feel like the state's going to open it and chuck it in the trash can. Like what?
Go straight to the shredder. Say thanks.
I don't know. Anyway.
So have to state my intention to perform this. And there's lots of different third party platforms that this is available on that kind of makes this more accessible to these clients. And on these third-party platforms, you as the vet have to identify your name, you have to give them your license number, and basically in Georgia, they say that you have to meet all of the standards of practice in there. So I have to have a Georgia license. The state Georgia board is going to check on that And then there's a clause in there that says that you have to primarily work in person in order to do telehealth in the state of Georgia.
What does that mean?
That's a great question.
Is that 51%? Is that 70%?
I'm like, how is that, 30 patient-facing hours in a week?
Yeah.
Is it I come in and do like a rabies clinic on a Saturday? Does that count? I don't know. Like,
Yeah.
That was one of the questions I had because, I'm licensed in Florida, but I practice in Florida maybe once or twice a year.
Yeah, maybe.
Yeah, sometime like this year. None. Did I go? No, I didn't go to Florida this year.
No.
And I'm also licensed in Alabama, and I've actually never practiced medicine in Alabama.
like physically practice medicine.
No, not once.
Yeah.
Yeah.
Licensed in South Carolina, I have there. Not in years, but I think the way I interpret that is you can't. The way I look at that is if it was the situation was reversed and I was living in Florida and I never came to Georgia, I should not be practicing telehealth there.
Right. Yeah. So I did some research. I tried to go undercover a little bit, to prepare for this podcast, and so I, went on one of these third-party websites.
You would be our designated undercover agent.
I have a curiosity, and sometimes I just got to go do stuff. But I'm like, okay, I live in the state of Georgia. I have a horse. I would like a telehealth appointment, and they gave me a list of names of veterinarians that were licensed in the state of Georgia. None of them were physically located in Georgia. None of them.
That's interesting.
Yeah, I looked it up. None of them were in Georgia. But I could get an appointment with them.
Was there anywhere? Were they anywhere close? Like adjacent states?
I mean, one was in Virginia, one was in Texas, one was in California,
Okay,
one
so
was
not
somewhere
really.
up north. Like,
Dang.
none of them were physically in the state of Georgia though. But they all had. I clicked on them all. They all had licenses, like in multiple states.
Interesting.
So I'm like, I don't know how that works. Which, again, we'll get into it later. Some of the language in here is a little contradictory of there. So, so you have to primarily work in person in the state of Georgia sometimes, I guess.
Question mark.
And there is also a statement in there that you must have a valid VCPR with a client and a patient. But you don't necessarily have to have one with the client and the patient that you are working on right then and there.
So you just have to be responsible for someone's patient
In the state of Georgia,
in the
I
state
guess.
of Georgia.
That's kind of the way I understood it as well.
Yes.
But if you aren't located in Georgia and you're not practicing in Georgia, then how do you have that? And then can provide telemedicine?
Right. It's it's very vague language, and
Right.
and one of the questions it asked me when I was trying to make this account to get my horse seen was, they said, do you have a current primary care that you see in the state of Georgia? Like, has your pet been to see a veterinarian
Yeah.
in person? And that was one of the questions they asked me, because from my understanding, I was not able to get any sort of medication unless I had physically taken my animal to a vet or had a vet come out and see my animal.
I mean, that's good. Ish.
I wasn't about to pay $200 to make an appointment.
Yeah, that's fair. Write it off on your expense sheet.
I know. I was like, I'm just going to turn it in and be like, this is
Podcast
for research.
And I think that's where it gets really confusing. And one of the things I see is I think there's some benefits in this when you look at the shortage we're facing on
Yes.
the large animal and the equine side. Because one of the rules I read in here is if there's not a veterinarian available within 50 miles.
Which that's real.
You get down to South Georgia, and that's really real in some of these cases.
So that's interesting too, because I was reading just some of the kind of discussion that was around this, and they specifically referenced Hurricane Helene that ran through here a couple years ago, and how when that happened, that prevented a lot of people from being able to go get care. And so that's where some of this language came around, was if there is no veterinarian within 50 miles that can get to your animal in 24 hours, or you can't get to them within 24 hours, then you're allowed to get some sort of tele-triage and maybe treatment with that.
Well, and it's interesting because, again, I didn't know I was breaking the law, and I guess now I'm recording this for everybody to hear. But you know what? I still feel it was the right thing.
They can't retroactively punish you, right?
I have no idea. So, a situation I was in a few years ago, the big fires that were out in Granby, Colorado, a lot of these horses were shipping into a friend of mine's ranch. And they're already, at that time, they're in the middle of nowhere, Colorado. I mean, there's hardly any veterinarians.
On a good day.
On a good day.
Yeah.
These horses are shipping in because the fires weren't in their area and they were fairly well protected. So they had a lot of horses coming in. Some of these horses have been injured. There was no way for a veterinarian to get there because everything around them was on fire.
Yeah.
Right.
And so it's kind of a situation where they were already worried because they can't really evacuate because everything's on fire around them. But then nobody could get to them because they've all had to evacuate. Mm-hmm. In that situation, I'm getting phone calls, and we're treating a lot of these horses over FaceTime. And I'll be honest, I wasn't licensed in Colorado, and I wasn't telehealth, I guess, back then didn't even exist. But I was at the point where I was not going to say no because I did take an oath when I graduated
To help.
to help.
Yeah.
Yes.
And I was like, you know what? If they're going to come after me for this, then come on. Because I still felt like it was the right thing for the horse.
Yeah.
And so, we treated a lot of those horses the best we could over FaceTime. And that's when I actually learned how to use FaceTime. Because, again, I'm technologically
Now
challenged.
you're a pro.
Yeah.
But I think that's important. Like, there's a clause in there that if we're going to do telemedicine, we have to inform the client that there's limitations.
Right. And that was the thing. I was like, I'm doing the best I can here.
Yes.
And also know these people. Mm-hmm. I know their capabilities. Mm-hmm. I know the facility. I hadn't been there in probably a year at that time. I think I was there at Christmas and this happened that summer.
Yeah.
But I was having to do the best I could because, again, they didn't have another option.
Right.
Yeah.
So I was their best option.
Mm-hmm.
And I took an oath. And if I get in trouble for that oath, for me following that oath, you know what? Come on. I'm ready.
Right.
But so I think there's times where there's times you can use common sense. Mm-hmm. My biggest fear when we start getting into this and what I don't want to see is we start to lose that VPCR. My biggest concern is you have these large online pharmacies that are there. They make their money selling drugs.
Mm-hmm. Yeah.
And what I don't want to see is them employing veterinarians that can sign online scripts without, because that's not in the best interest of the animal.
No.
Right. And
It's
again,
not.
I think, and I feel like the medicine in general, like across all things, veterinary medicine, human medicine, everything, it's all changing where there is this big shift to this telehealth because we have learned, I think COVID was a big highlight of that there are a lot of things that we can do without physically needing to be in person. But I'm driving around here. I saw like a pet labs thing the other day and it was like it looked like a Quest lab where you go in with your pet and you say, I need this. And I'm like, is that from the telehealth? Like, is that from, a vet saying, okay, I need you to go and do these diagnostics?
Yeah.
They just send them over there. I wasn't sure. I was like, but that's, you're we're seeing this trend now. And I'm like, what are the limitations with this? Because I'm like, I can't vaccinate something.
Through the phone.
And the thing is,
I can't tube the colic.
I can't suture a laceration
Yeah.
over the phone. Like, I think as Dan said, like, as we're going forward and we're addressing the shortages in the service aspect, like, there's just not enough of us out there. I think I saw a stat the other day for however many millions of horses are in this country, there's only 4,000 equine vets. That's not a lot.
No.
Like, that's not a lot. So, like, we have to address this shortage, and how do we do that? And I think, obviously, we've been practicing, tele-triage and tele-advice for a long time. So I think there is there is validity and there is benefit in the telemedicine, but I think we have to be very careful about how we do it, because it's never going to replace being in person and using all of your senses and getting the whole picture and treating that horse holistically. It's just not.
No.
Well, it's, I've had to do this a long time because I do work, I work out of country, and obviously if they have an emergency, I can't be there.
Right.
And there's not another equine vet on the island.
Yeah.
There's veterinarians, none of the equine vet. And there's a big difference. Like I tell people, and I'm actually proud of this. I tell people I'm an equine veterinarian.
Yeah.
And I'm very quick to tell them my dog gets sick, he goes to a vet.
Right.
I don't even treat my own dog.
I don't even treat my dogs.
Nope.
Like I don't, I'm an equine vet. And it's such a specialized field. And so I have to do a lot of telehealth and a lot of telehealth in this other country. And I'm trying to do and there was 2 years I couldn't go there.
Yeah.
2 years we had to manage every horse on that island without any veterinary help.
Yeah.
And I mean, it was just me, FaceTime, and like, here's what you're going to do. I mean, the things that we were able to do, and it was pretty amazing. But at the same time, the frustration I would feel, because it's like, I need this information, but the only way I can get it is if I'm there.
And I think it's...
Can't do a blockathon.
No.
Can't do a blockathon. You can't rectal.
Yeah. And I think it's hard to feel like you're doing a really good job and feel like you're providing the best level of care for that animal if you can't be in person and feel comfortable. Like you just can't.
And I think that's the big thing I don't want to see this try to do, is replace that in person. And what I worry about is, my jokes always follow the money.
Yeah.
And it's not a joke, but I guess it's kind of just a truth of life, follow the money. And my concern is, are we going to get into where we got big pharmacies that are doing the telehealth so they can just sling meds? Mm-hmm. And then what really worries me is if I go out there and someone's been seeing somebody for telehealth and I don't know all the facts behind the case.
Correct.
I don't know what they're on. Or we've got meds just willy-nilly going to a barn or going to some place that we have no idea what's going in and out.
Yeah.
Because there's certain cases and there's certain meds, like, we need to know this.
Yeah.
And one of the things I did read in here is, like, it's within your scope of veterinary practice.
Yes.
So this is where I'm saying, like, my biggest worry is, are we going to have people that are not equine veterinarians trying to play equine veterinarian over the phone?
That would be me. That would be like me trying to treat a ferret over the phone.
I feel like me trying to treat anything but a horse over the phone.
I have no idea.
I've had people ask me about, like, I think it was a bearded dragon. I was like, I was like, vitamin A. I know there's something with vitamin A. It's like, try that. Too much lettuce. Not enough lettuce. Like, but it's, again, like, you get into your niche in vet med. Like, yes, we do learn all of the species through school, but the majority of us, we pick a couple species.
I haven't thought about a cat snake since I took my exotics test, and that was it. Like, I've never thought about a ferret since.
Well, and I'll be honest, I've even over-specialized inside this field. I mean, if you look in the last 10 years, it's been my job to keep things performing.
Yeah.
Like, I go out on emergency, one night a week, one weekend a month. I'm like National Guard and the ER over here.
Dan will turn a colic into a lameness so fast.
Like, Dan, focus.
Not right now.
I was proud of myself the other day when we had that pony colic in here. It's like, well, it's been 48 hours NPO.
You did good.
Yeah.
Hepatic lipidosis may be on the way.
Yeah,
I was like,
it sure was.
Yeah, doing internal med.
I mean, got some internal med going, but that's the other thing is, like, I'm so specialized in what I do. It's a different, I'm specialized within a specialized field.
Yeah.
Right.
And you get to the point, I mean, we've had this discussion because, we've all worked with veterinarians that get highly specialized in, like, the sports med aspect. And when you don't do general practice anymore, you forget
Oh, yeah.
all the stuff that goes into general practice.
I remember in school, like, if one of our internal med cases, like, got a little lame or something, they were like, I'm out.
Yeah, I'm out.
They're like, don't ask me about it.
Go across the hall.
Like, unless it's got a laminitis thing going on. Like,
And you got the surgeon in there like, what are y'all looking at with that ultrasound? Liver.
Yeah.
What's
that?
Yeah.
I forgot it had that probe.
Yeah, I knew you could feel it when you're in there. But, but yeah, and so I think that's the biggest, my concern in all of this. I think there's a lot of benefits.
Yeah.
Because like I said, just in our state, you get south of us, there's not a lot of care. Mm-mm. And I've definitely gotten those calls on emergency. Actually, I didn't know at the time I was breaking the law, but I was like, hey, we need to get you somewhere.
Yeah. Mm-hmm.
Like, I'm not going to tell you what to do because I can't. Because I knew that was against the law.
Right.
I was like, we got to get you somewhere.
Yeah.
Because you want to help them. Like, because again, it's like, and it's always like something like real traumatic. It's always something real bad. And you're like,
and you hang up the phone and you're like, oh.
I know. And you're like, I want to help you. I want to do what I can. But like, my hands are tied.
Yeah.
But and that's one of the reasons we built the hospital here. It's like, look here, we got a state-of-the-art facility. Mm-hmm. We can do just about anything here. All you have to do is get them here. But I've definitely been. I had one the other night. The poor lady's in a wheelchair.
Yeah.
Husband's out of town.
Yeah.
Horse is colicking. She can't get a vet that'll come out, and she was too far away for us to go. And I'm literally on the phone with her trying to find anyone. Yeah. And it was the worst feeling in the world.
Because you can't. There's nothing you could do.
There's nothing I can do.
And I do worry too. Like you were saying about, big pharma pushing this and everything. I do worry. I've seen marketing ploys on social media and things by these new companies that are pushing the telemedicine that are basically, it's not victimizing. What's the word I want to say? Vilifying the visit to an animal hospital, or vilifying a visit too, because they're like, oh, your pet's anxious and they had a terrible visit and you waited 20 minutes in the waiting room, and they're villainizing how we best practice veterinary medicine to push this marketing of the telehealth. And I worry about that because, again, this is, I think there's a lot of benefits to the telehealth and the telemedicine. Like, I think if it's done appropriately, it can really help widen the scope and the services that we can provide. But if it's pushed to try and replace an in-person visit, I really worry that a lot of animals are going to suffer because of it.
One of the things that comes to my mind is, y'all all know I call it my wife's dog, I guess technically. It depends on what the dog's doing. It's whether it's
if it's a good day or a bad day.
Yeah, if it's 4 a.m, the dog needs to go out. It's our dog.
Dang it.
Other times it's her dog. Mm-hmm. But that was a situation we were dealing with, a respiratory situation. But the respiratory was actually secondary to an IBD that was causing a regurg, that was causing the aspiration.
Yeah.
Guess what? You're not solving. If you'd just thrown this dog on antibiotics for the respiratory infection because it had a cough, and that was your symptom, is it had a cough, and we would have never fixed the dog.
Right. That dang chicken feed really got her.
Chicken feed.
Good Lord.
Good Lord. I have a lab.
Well, yeah.
With a sensitive stomach. You know what you don't want? A dog that will literally eat anything, anytime, anywhere.
Needles, glass.
Yeah, with a sensitive stomach. But
she just forgets that most of the time.
Oh man.
So, I think I agree with you, Caitlin. Like, that's my biggest concern is I do see these ads where they're vilifying. But in the same token, I talked to a friend of mine the other day. She does a lot of behavioral work.
Yeah. Yes.
She does a lot of behavioral work. One of the dogs she's working with is very aggressive when it comes into the veterinary clinic. Mm-hmm. They're trying to do behavioral stuff. This is a great opportunity.
Yes.
I think that's fantastic. Yes.
And because she was actually the one that called me when she was like, hey, Dan, what's going on with this new change? I was like, I am trying to get a hold of the law.
Yeah.
Which is not the easiest thing to find, by the way. Because she's like, I think I can utilize this. Mm-hmm. She's like, I've got these aggressive dogs that are very aggressive when they come in. We're working on behavior stuff. I don't need to expose myself and the staff.
No.
The dog is much better at home. If I can do this through telehealth, this is a much better situation.
Yeah.
And I mean, she had a VPCR. Everything was great. And I was like, yes, that is absolutely a great place.
Yeah, that's fantastic. You can make positive change based on your virtual interactions with that dog that keeps everybody safe, keeps the dog low anxiety. You can assess, and then you can change the management plan and make progress without putting people at danger. Like, I think that's fantastic.
Because one of the things, and this was a few years ago, there was some of the big pharmacies, they were sending veterinarians to horse shows. And the veterinarian showed up, you brought your horse over, you got an exam, and you established the VPCR, and then whatever you wanted, you sent the script in, this vet just sign off on it and send you whatever med you wanted. That's not good.
No.
So from multiple aspects, right? One, it's not great care for the horse. Two, a lot of times this was an antibiotic situation. There's antibiotics that are good for one thing and not good for another.
And antibiotic resistance is real.
Antibiotic resistance. So all of a sudden we're throwing an antibiotic at something. Like respiratory is a big one, right?
Yeah.
How many respiratory cases we see that are an actual pneumonia versus an asthma?
Right.
But it takes more than, let me look at your horse, listen to it cough. Doesn't have a temperature. Because I've had respiratory infections that didn't have a fever. And I've had respiratory infections that did. I've had asthma cases. And then again, it goes back to, okay, you're standing inside that barn and this horse has got an elevated temp, but that barn's also like 112 degrees.
Yeah.
And it's got a low grade temp. Like there's so many of these little factors that go into this that, and I remember AEP did speak out on that and said that's not a VPCR. And they got the AVMA on board, which is our, I guess I would say that's the group that represents us. The state boards represent the public.
Yes.
The AVMA is the group that represents us. And AVMA was like, that's not a VPCR.
Right.
Yeah.
Again, it's not codified, but it goes to the standard of care side.
Correct.
Because I didn't think that was good for the pet.
No.
It was not good for the horse.
No.
So I think as we work through this, I think there's going to be a lot of these situations come up. And understanding what role it plays. Because like I said, we didn't realize this. We've been doing this forever. We're probably all going to go.
And it was needed. It was a much needed, expansion on the Veterinary Practice Act, just to say, hey, we are in modern times.
Bring it up to speed.
And this is, they probably realize this is what a lot of us have been doing, like across all the disciplines.
Yeah.
And they're like, we need to reflect that in the language.
I just think it's important for people to remember, like, if we're pushing to see a patient or we are pushing to establish that VCPR, it is for the animal's best interest. So like Dan said earlier, we're not trying to be difficult. It's not because we're money hungry. That's not it. We're trying to A, follow the law, and B, no, probably honestly reverse. A, do the best interest of the horse, and B, follow the law.
Follow the law, yeah.
Like we are, sorry, just is what it is. But like that, we're trying to do best practice to provide the best possible care that we can and get as much information as we can to do the best in less appointments and save you money.
Yes.
Like that's what we're trying to do.
Well, I mean, I think really, if you, our best goal is like, what's best for the horse. I mean, our motto around here is like, for the horse.
Yeah.
Because that's who we're here for. We're here for the horse.
Yeah.
Yep.
And so every decision we make, we say, what's best for the horse? Like I have seen us do more. Like I can't tell you how many times we talk in Monday morning meetings like, well, this is the right thing for the horse. Because that's who we're here to speak for.
Yep.
And we're trying to do what's best for the horse. And I think telehealth, because I think when we looked at this, the last real change to the Practice Act was in 2006. Well, you think about 2006, we had cell phones.
The iPhone came out, I think, in 2006.
Did it?
2006 or something like that. But
Oh my gosh.
I was trying to figure out, these things popped up on my flip phone and there was words on it. And I'm like, what is this? And it was this thing called a text message.
Oh.
That's
a revolutionary technology.
yeah. I mean, I was still like, I remember when we got caller ID on a cell phone. But I think that's the thing. I was glad we did make some updates because again, technology has changed.
Yeah.
And like all things with technology, it's a tool. It is a tool, and it's a tool that can be used for good, and it's a tool that can be used for bad. And I think you have to remember, we're not here, like, it may be more convenient, but is that really the best? And is it going to be the best in the long term?
Right.
It's not a replacement
Yes.
for a traditional kind of in-person care.
Yeah.
I think that's what it comes down to.
Yeah.
Because, you know, I've used a lot of this. I've got horses that, you know, they live on the road. They're in all kinds of states or at showgrounds. And, yeah, I get calls most weekends because, again, my people work on the weekends. That's when they're showing. And I'll get calls all the time, and they're running through like, hey, and 90% of them are like, the vet's here. Do I need to go see him? Yes. And it's not, and then I'm getting the phone call out because I was like, all right, I need to know what the vet found afterwards. Why? Because I got to keep taking care of this horse.
Right.
Yes.
And so I stay highly involved. You know, they see a vet when they're out of town. The trainers are calling saying, hey, this is what the vet found. This is what's going on. Like, great. I need to see you on Monday. I need to see you next week. And so we can take back over. And that's part of the world that a lot of my horses live in, because they're going a lot. You know, they may be in Florida. You know, I've got some horses that go to Florida for the winter. Well, they're keeping me informed of the health status of this horse while they're there. But I'm also getting all those records because, again, they're going to come back sometime by March or April, and I've got to follow up
Yeah.
Yes.
on all these things.
Yeah.
So I think there is a lot of value. But at the same time, it needs to be used correctly.
Yeah.
So,
Cool.
All right.
all right, all our listeners out there, if you're more concerned, if you're more confused after this podcast, like,
Join the
we didn't
club.
even really get into like all the loopholes. Like, every time we think like, okay, this is a rule, we find another section in here that like, well, that
You don't have to do
nullifies
that.
that
Like,
rule.
you
Yeah.
can- there's
It's very vague and contradictory in and of
Yes.
itself. Like the verbiage of the
yes.
act is interesting. So again, if you're a lawyer,
Please
Come
help
on.
us.
If you're a lawyer, I'd love to have you on the podcast. I'd love you to sit down if you truly understand this. And if you're on the Georgia State Board, or you know somebody on the Georgia State Board, and they would be willing to come in and sit down and talk to us and really explain how this works, love to have you on the podcast. Because like I said, I think just helping people understand, like, when we're saying some of the things that we do, like, these are the rules we're playing in. And these rules do not exist to make your life difficult.
No.
They exist to protect, because the people that make these rules are not there to protect veterinarians, they're there to protect the public,
correct.
which is a great role,
Yes.
but they're there to protect. And so they're trying to make the best decisions and put rules in place that best help the animal. So just remember that if you think of veterinarians being a pain, they're really not. They're trying to follow the rules. Those rules were set there with the best intentions in place.
Yeah.
Are the rules in this new one perfect? Absolutely not. But at least they're a start.
Yes.
I think you're going to see more and more of these rolling out into different states. I think you're going to see more and more adaptations to this in different states.
I think from what I saw, all 50 states now have made amendments to their own Veterinary Practice Act to include telehealth, or language that at least includes telehealth. So it's happening. It's there.
Yeah.
You know who one of the first people to embrace telehealth was? USDA.
Oh yeah. Yeah, because nobody wanted to drive out to all those like cattle ranches that are in the middle of nowhere.
USDA was having to do it because, again, we talk about our shortage.
Lord.
They've got a huge shortage.
Yeah, they do.
Like, you can drive
So-
12 hours and you're still in Montana.
Yeah.
True.
That's crazy.
So, well, everybody, thanks for listening today. I hope we didn't confuse you too bad. And again, if you're not in Georgia, if you can talk to your veterinarian about what the rules are in your state.
Yes.
And just understand, if your veterinarian says they can or can't do something, they have to play by the same rules as you just heard.
Yep.
All right. So I think that's really important to understand. Like, we have rules. If you learn nothing else from this, understand, like, when your veterinarian says something, says they cannot do something, it's because they jeopardize their license, they jeopardize their livelihood, and they jeopardize what they worked for their entire lives. Like, you think about 8 years to become a graduate, that's just your schooling.
Yeah.
And then people have built entire careers and their livelihoods around practicing medicine. So when they say, I can't do that, it's not them that's causing the problem.
No.
And remember, the people that are setting these rules, they're not set to make life difficult. It's set to take the best care of the patient as possible.
Correct.
So, Well, thank y'all for being here today. Really appreciate it. I keep forgetting to say this on the podcast, but we need you to like and subscribe. If you don't want to like and subscribe, don't. We really and truly, I say it, and I really would love for you to do it. But if you don't want to, I get it too. That's fine. Just listen and learn. That's what we're here for. We're here to get some education out there. Listen, learn. Hope you enjoyed it.
Start a conversation.
So, Dr. Brown, thanks for being here. Dr. Hoffman, thank you for being here. April, thanks for recording this. Casey, thanks for all the edits. Thanks for making us sound good. So, we appreciate everything y'all do to make this podcast possible. Thanks to our listeners out there, and to all the customers we serve here at Countryside Equine Hospital. Thanks for being a part of it and keeping us from having to get a real job.
Yeah, thanks for scheduling appointments when we say it needs to be seen.
Yes. Thank you. Appreciate you.
So everybody out there, y'all have a great week. We'll see y'all next week. Take care.
Bye.